Mr. Arua Samuel Oko. He is a registered dental therapist and a member of the Orapu College of Scholars. He is currently working with Zoom Healthcare Limited in Abuja, and his topic is dehydration and oral health. So he has a few minutes to give us his presentations. I employ we all listen, jot our questions down, and then after the presentations, we'll give room for questions, sorry. So Mr. Arua, please, the floor is yours.
Good morning, everyone.
Good morning, Samuel.
Can you hear me? Thank you. I'm privileged to be here and as well to be a presenter for today's Oraposium. In today's presentation, I'll be dealing with, first of all, I want to thank the registrar of the program, Orapu, in the person of Dr. V.E. Adam. Truly, this is a platform that has helped us to harness our potentials in the health sector. And today, the topic I'll be running through is dehydration and oral health. So I want to thank everyone that is here present to listen to my presentation. Please, I'll take some time. In this presentation, I will be running through the following outlines: introduction, dehydration, causes of dehydration, oral manifestations of dehydration, the management of dehydration, and conclusion and references. Dehydration is a deficiency of water in the body, which happens when the body loses more water than it takes. And of course, these days we've really understood the fact that a lot of people experience this devastating condition called dehydration, and it's my pleasure to talk about it today to enlighten people, our listeners, and the public that may see this information later on how dehydration can go as far as affecting their oral health. There is a way the body works. It regulates water balance through a mechanism called homeostasis. This homeostasis just kind of maybe stimulated. It also happens with the aid of a part of the brain called hypothalamus, which stimulates your body to give it a feeling of taste for water, using by the help of vasopressin, that's an antidiuretic hormone. And there are ways we know that we are dehydrated: when we feel tasty, when we feel confused or something, or fainty, or we notice that our body is a kind of dry. And there are ways our body loses water as well, maybe through physiological activities like urine, sweat, and maybe respiration. As I said earlier, dehydration is a very devastating condition, and anybody shouldn't experience it in his or her lifetime. Dehydration is a condition common among elderly people, maybe who are sports people, elderly people, particularly sports people, aged due to maybe disease conditions like diabetes and some other ones that may lead to the loss of electrolyte and water in the blood, in the body. Also, it is common among children. It's also common among children who particularly may be having some kind of diseases like diarrhea and vomiting. Now, there are oral manifestations of this dehydration. When your body lacks water, it will also be noticed in the mouth. And of course, we know that the saliva we have in our mouth is, as in a higher percentage of it contains water. And if the body lacks water, it will indicate in the mouth. It can easily be seen or noticed in the mouth. Hopper and Bonner 2016 stated that decreased intake of water increases the susceptibility of both infants and young children and adults to dehydration and its devastating effects. And of course, as I said earlier, the common causes of dehydration: diarrhea, vomiting in children, fever, renal failure in adults, diabetes, ketoacidosis. Ketoacidosis is just a condition where the body produces more acid in the blood than normal. And certain medications, maybe the use of diuretics for people who are treating conspicuous urination, who uses diuretic drugs, and maybe chemotherapy, people who are undergoing chemotherapy or radiation treatments. There are external factors as well that can lead to dehydration, which could be no or poor supply of water or safe water. It's true that before you get dehydrated, it will mean that you're not actually taking enough quantity of water, enough water. And the reasons why I stated this as one of the external factors that lead to dehydration, no or poor supply of safe water. You may possibly want to drink water, but the water available is not safe for drinking. So you will not drink. And as a result, you may be predisposed to dehydration. And lifestyle as well. For people who are smokers, who take caffeinated drinks, who like high salt containing foods, it can as well lead to dehydration. Then exercise. Sports people, of course, when we watch football, we see some of them, sometime in between time, they will go by the side to take water or water with a kind of flavored water. They do that to keep rehydrated, to keep themselves fit for the sports, for footballing, because once they feel that dehydration, they cannot continue playing again. They will lose stamina. In fact, they will be confused and possibly fainting may set in. So there are certain diets as well that can lead to dehydration, and all these are predisposing factors of dehydration. Dehydration reflects in the mouth, as I said earlier, and when the body is dehydrated, it goes a long way to affect the salivary glands in the mouth. And of course, we know it is the salivary glands that produces the saliva that lubricates the mouth. Saliva in the mouth serves like blood in the body. It is the saliva that can trap microorganisms that enters through the mouth. It is the saliva that lubricates the teeth against frictional forces, lubricates the teeth against caries, against some other factors. So if this saliva is lacking in the mouth, if there is low supply, inadequate supply of saliva or secretion of saliva in the mouth, a lot of complications will set in. In that case, we need to understand, this is now when we need to understand the fact, the truth in the statement that dehydration affects the mouth. It has a lot of oral manifestation. So those oral manifestations of dehydration includes dry mouth, which is professionally termed xerostomia. Cleveland Clinic in 2021 stated that if the body loses as little as 1.5% of body water, it will naturally respond as taste. It will naturally respond as taste. And these are one of the ways we as well notice, or when we listen to our body, we know that taste is one of the ways we notice that dehydration is setting in. Also, other researchers like Nitala and the rest of them in 2019 have also supported the fact that dehydration is linked to xerostomia is linked to dehydration. Xerostomia results from under-secretion or no secretion of saliva that lubricates the oral cavity, and if the oral cavity is not adequately supplied with saliva to inhibit the effects of dental plaque, it will cause halitosis, dental caries, periodontal disease, and dry tongue, and a lot of other complications. Even the gum will also be affected. So when you have dry mouth, a lot will set in. As we go on, then we also have halitosis. In fact, xerostomia is the mother of everything. Everything is just linked to xerostomia, because when you have dry mouth, there will be no saliva. There will be little or no saliva in the mouth to get rid of food debris, okay, and to reduce the bacterial load in the mouth. Therefore, halitosis can as well set in. Banerjee in 2020 described halitosis as a condition that produces foul smell in the mouth. There are many causes of halitosis, which includes dehydration as well, as we've all been hearing, as I've been saying. And halitosis due to dehydration initiates from xerostomia, which results from the decreased or no saliva supply in the mouth. And if, as I said, if these oral biofilms in the tongue diseases are not removed, or periodontal tissues, halitosis will become complicated. Then sudden speech impediment. If I don't know how we can test it, okay, let me use pastors or public speakers. Let me use pastors or public speakers as an example. Pastors, each time they want to preach, or public speakers, they have water by their side. The reason is not just because they want to drink water. They kept it, that water is kept by their side to ensure that they don't get dehydrated, that their mouth don't get dry. As they are talking, the rate, as you talk, as you open your mouth, the rate of saliva secretion reduces as compared to when you close your, when you're eating. If you're talking frequently, the rate at which saliva is secreted reduces. It comes down. So the only way you can kind of maintain the rate of flow of saliva or secretion of saliva in the mouth is by lubricating your mouth with water. So these public speakers, when they are talking, their mouth gets dry in between their speech. So, and if they don't drink water at a point in their presentation, they will not be able to talk again, because it is saliva that helps in the articulation of words as well. So speech and articulation of words is aided by the oral structures and saliva lubrication of the mouth. If the mouth is not supplied with saliva, speech will be difficult and even impossible. As well, the dysphagia. Dysphagia is just the inability to swallow. Simply defined as the inability to swallow. Saliva in the mouth is chewing and swallowing, and as well digestion. Of course, we know that certain foods like carbohydrates, the digestion starts in the mouth. And those enzymes, amylase and the rest of them, are contained in saliva. If the saliva is not in the mouth, if there is no supply of saliva in the mouth, if there is no secretion of saliva in the mouth to provide these enzymes that start the digestion of carbohydrates or certain nutrients in the mouth, then digestion will not be complete. It won't start properly. If you put any food in your mouth and there is no saliva to aid the chewing, you cannot chew well. Just try it. Put something like gari or bread in your mouth, enough quantity of gari or bread in your mouth, and you notice that it will soak all of the saliva in your mouth. And if there is inadequate supply of saliva, you will not be able to chew that bread or any food you put in your mouth. Therefore, if there is no saliva in the mouth, you will not be able to chew. And if you are not able to chew, there will be no saliva to lubricate the esophagus for you to swallow properly. This is how bad dehydration can be. It starts by affecting the salivary glands, parotid glands, and the rest, and goes beyond that by instigating xerostomia. And as xerostomia sets in, you see halitosis. And as halitosis sets in, other ones start coming in. You find out that you cannot eat properly. Your body system will be feeling the impact of malnutrition because you won't be able to eat. And if you're not able to eat, you'll be lacking some nutrients. So the digestion of certain nutrients, as I said earlier, like starts in the mouth with the action of the saliva enzymes, amylase. All right. Without saliva secreted in the mouth due to parotitis, yes, like as I've been explaining, if dehydration sets in, there is the high tendency that the parotid gland will be inflamed. You will have parotitis, yeah. And chewing, swallowing, the digestion process of carbohydrate will be affected. Now, there are other conditions, there are other oral manifestations of dehydration. When there is no saliva in the mouth to inhibit the activities of the bacteria or to reduce oral biofilms, then the gum health will also be affected. The health of the gum will also be affected. You will be having periodontal diseases. Gingivitis will set in. Periodontitis will set in. Dental caries will also set in. Dehydration truly is a devastating condition which I wish everybody should know about and employ every possible mechanism or method or approach to ensure that they don't experience it all through their life. Management of dehydration. There are things you can do to ensure that you don't have dehydration, or when you have it, that you manage it and the effect will not manifest in your body or in your system. 1, increase fluid intake. You do this by sipping water or unsweetened drinks at all time, regularly. While in school, I had a friend who was always carrying water with her. I couldn't really understand it because then my mind wasn't open to the fact that dehydration can be that bad. At a point, I see her body get dry and scaly. Then I decided to, when my concern rose about her, I had to ask her, what is wrong with you? Why do you carry water all the time? She started telling me her stories, the ordeals she passed through. Then I realized that taking water is very important when it comes to the management of dehydration. Also, you can suck on sugar-free sweets, chew sugar-free gums to stimulate saliva flow in the mouth. When you do that, like xylitol is one of the gums we always talk about, is sugar-free. When you chew on it, when you chew all the time, there will be constant flow of saliva or secretion of saliva in your mouth. And if that happens, if you do that, the tendency of you having dry mouth will come down. You can suck on ice cubes to moisten your mouth. You can also avoid alcohol or alcohol-based mouthwashes, caffeine, and smoking. Like I said, lifestyle also increases your vulnerability to dehydration, and such lifestyle includes alcohol intake, take of caffeines and smokings and the rest. So if you can avoid all this, you will manage dehydration very well. The effect will not be devastating to you. Saliva stimulants like Exozac and pilocarpine. These are stimulants that you can take, and when you take them, it will stimulate saliva secretion in your mouth. So when you do this, you will manage dehydration and the effects and the oral manifestations properly. All right. Before I go to the conclusion, I want to talk about certain conditions that make us naturally predisposed to dehydration during hot summers. That is dry season. When you feel hot, your body, the rate at which your body demands for water increases. So, and if you don't listen to your body within that time, if you don't listen to your body, then you will not take water and you'll be dehydrated. Then some authors have as well shown that dehydration can set in during cold seasons. Yes, because during that time you feel your body is cold, there is no need for water, and the rate at which you sweat will reduce. And when it does, you will not, the urge, the taste, to drink comes down. And of course, we know that there are internal factors that causes dehydration, like when you have liver issues where the vasopressin is not able to regulate electrolyte balance in your blood, like if if there is not enough water in your blood, the vasopressin will restrict the amount of water excreted so that your body will maintain proper balance. And when this happens, and when this vasopressin does not work properly, even if you take water, dehydration will still set in. Therefore, we have to listen to our body even during cold seasons, because at that time we may not even feel like drinking water, yet our body is demanding for water and electrolytes. So at that point, at that point, we need to drink water. Also, people who do sports, who run, maybe athletics and the rest of them, they need water at all times. Even during season, if you're running, you'll be excreting water from your body. Okay, so and at that point you also need to carry water, so that as you're running and sweating, you'll be replacing the water loss in your body, so that dehydration will not set in. So dehydration is very devastating, and it can cause shortage of body fluids like water. It is associated with systemic disorders such as renal disorder, diarrhea, and the rest of them, and external factors such as drought, excessive exercise. Dehydration can be diagnosed through its manifestations in the mouth. Like several authors have proven that the mouth reflects the health of the body. It also affects the health of the general body. So what that affects the body can easily be diagnosed in the mouth. Just like HIV can be seen in the mouth, COVID-19 can ask, it is through body fluids that you can get COVID-19, particularly through the mouth. So you need to take care of your mouth very well to ensure that when your body is speaking, you detect it in the mouth. So dehydration can be diagnosed through manifestations in the oral cavity, and the effects such as xerostomia, halitosis, etc. also impact oral health negatively. Now, for us to ensure that we don't have dehydration in all through our life, we need to take water to ensure that we balance the loss of water in our body. Thank you for listening.